God's sake, give more power to the people. There's some people up there holding everything, telling lies, giving alibis about the people's money and fame. And if they're gonna throw it away, might as well give some to me. Yeah, they've seen and heard of, but never had misery. There are some people who are starving to death, never knew but only heard of, and they never had happiness.
Oh, if you don't have enough to eat,
How can you think of love? You don't have time to care. So it's time you're guilty of. Oh yeah. God's sake, give more power to the people. For God's sake.
And welcome to Heal DC. This is Joni, and we're going to definitely talk about giving more power to the people today. We are focusing on really a new crisis in our DC healthcare system. The mayor has proposed some changes in the budget, which will drastically impact our healthcare system as well as much more. And it's heartbreaking to many of us who, this show, for example, was started in the early 90s during the closure of DC General, and we fought for certain things that are being challenged today by the mayor. So to discuss this crisis, we have five healthcare heroes joining us today to walk us through what's happening. We're going to be introducing them one by one, but first you're going to hear from Lisa Meehan with the DC Legal Aid, who's going to kind of break it down for us, what's happening. Maria Gomez, who was a founder of Mary Center way back in the late 80s. And again, these are healthcare heroes you're going to hear from. Kate Sugarman, who's a physician at Unity Healthcare. Dr. Edwin Chapman, who is a beloved healthcare advocate in our community. And last but not least, Michele Tingling-Clemmons, who helped me found this show, To Heal DC, many, many decades ago as part of the PFW family and Award 7 resident. So with that said, we're going to jump right in and welcome Lisa Meehan with DC Legal Aid. And Lisa is going to give us a basic overview of what is happening, particularly with something called the DC Health Care Allowance. Maria is going to later give a little bit of the background of that, how that alliance started. But welcome, Lisa.
Hi, Joni. Thank you so much for having me. Can you hear me okay?
Yes, you're loud and clear.
Okay, great.
So give us a thumbs now concept of what is happening with the DC Healthcare Alliance with the vote today and the DC Health. Well, you'll tell us who the DC Healthcare Alliance serves.
Absolutely. So the DC Healthcare Alliance is a really important locally funded and locally administered public health insurance program here in DC. It's designed to cover folks who are not able to be covered by Medicaid. So it's a public health insurance program. It's free for the participants, people who are enrolled. It serves people who are under about 210% of the federal poverty guideline, and who are not eligible to be enrolled in Medicaid, which typically covers that kind of income group because of their immigration status. There's a lot of misconceptions around what immigration statuses are able to be eligible for Medicaid. A lot of folks think that, in any kind of lawfully present immigration status can be eligible for Medicaid, but that's actually not the case. Medicaid has very strict immigration requirements. You need to be what's called a quote unquote qualified immigrant, which is a really narrow set of immigration statuses. And so there's a lot of folks who do not fall into those categories, who can instead in DC enroll in Alliance. So that includes people who are undocumented. It also includes people with temporary protected status or TPS. And there's a lot of folks in DC. We have a lot of communities who have that status. It also includes a lot of people who have green cards, but who have had their green cards for less than 5 years. There are some exceptions to this, but a lot of people, there's a 5-year waiting period once you get your green card to be eligible for Medicaid. So while you're waiting to hit those 5 years, you can enroll in Alliance. So it's a really important safety net program. It covers about 28,000 DC residents and provides a lot of really critical health care for folks. And so unfortunately, what's happening in our budget is the council is trying to functionally eliminate the Alliance health insurance program. They're doing so in a way that is a little bit of a complicated phase out of the program. And that's frustrating because it makes it harder for people to kind of understand what they can be entitled to and eligible for during the phase out. But basically,
Lisa, if I can just ask you a question. You say what the council is trying to do. It's my understanding that this is a proposal by the mayor to cut this program. So maybe clarify that and then just keep going.
Absolutely. Yeah. Happy to clarify. So yes, it was a proposal from the mayor. The council had the opportunity to not implement the mayor's proposed change. And unfortunately, they've made some minor changes to how the phase out of the program is going to happen. But they're still moving forward with functionally ending the program for adults over the age 21 or over.
So this is the council and the mayor's proposal now.
Yes, now both the mayor and the council are looking to, again, functionally eliminate the program.
Mm-hmm. So my understanding that some of this will take place very soon, I think in late fall. Is that correct?
Yes, that's right. So, yeah.
So that'll be when the new fiscal year starts in October?
Yes, so starting October 1st, 2025, some of these proposed changes would go into effect. If the council votes to move forward with the proposed changes, then starting October 1st, people who are over the age, 26 or over, I keep trying to say over the age of 26, but it's inclusive of 26. So age 26 or older would no longer be allowed to submit new applications for the Alliance program. They would basically stop everybody's ability to apply anew for the program. And they would also lower the income threshold for the program to 133% of the federal poverty guideline. And for context, for a household of one person, that's about $21,000 a year would be the new income limit, again, for a household of one, just for context.
So the people who are currently on, the 28,000 people, they would be allowed to stay on, or they would be able to stay on?
Yes, assuming that they would still meet the new lowered income guidelines.
Okay. And what about children? Are children still protected?
So children will maintain their coverage. So people who are under the age of 21 are not affected by the kind of phase out of this program. Children who are under the age of 21 are currently in a program called the Immigrant Children's Program, or ICP, and they would be basically moving the children into the Alliance program. But the phase out, the functional ending of the program over the next couple of years is for people ages 21 and over.
Okay. And we're on a tight time schedule here. If people want more information from Legal Aid, is there an easy way for them to get it?
Yes, so you can go to our website, legalaidDC.org. You can also follow us on social media. We have a lot of calls to action available on our social media. We're on Instagram, Twitter, or known as X now, and Facebook at Legal Aid DC. And the main call to action we wanted to share during this show is the council is going to be voting on these proposals at noon. And so we really want to encourage people to call the council this morning to ask them to please save this program. It's a literal lifeline for a lot of folks, as you're going to hear from our other guests today. There are multiple council members who you can call, but the most important ones to call would be Chairman Mendelson and Christina Henderson, who runs the Health Committee. Chairman Mendelson's phone number is 202-724-8032. And Councilmember Henderson's number is 202-724-8105. And so we'd really encourage all listeners to call those offices this morning before noon, before they go in to vote, to tell them how important this program is to our whole community.
Okay, thank you so much, Lisa. And maybe you can hang on with us and repeat some of that information at the very end of the show. Thank you, Lisa, with the DC Legal Aid doing very critical work on this issue and many other issues. Now I'm going to, if we had a magic drum roll, I would play it now, but I'm thrilled to introduce Maria Gomez. Maria Gomez is a major hero in the healthcare, DC healthcare arena. She was the founder of something called Mary Center many years ago. I had the pleasure of working with her really for decades, back in the late 80s, 90s, into the 2000s, but we haven't been in touch recently. I'm so thrilled to welcome Maria Gomez onto our airwaves. And Maria, maybe we can start with you just kind of giving a brief history of the Alliance and also sharing the impact of what would happen if this program is dismantled.
Thank you, Joni, and thank you, Lisa. I hope you can hear me.
Yes.
Let me take us back to what was happening in our city simultaneously in the 1990s. My heart is just paining because it's just we're back to where we were today. But the first is that DC at that time has some of the worst healthcare outcomes in the country, at the bottom of the 50 states. Low birth weight babies, those babies born 5 pounds and 8 ounces below that was at 14%, and versus 7% for the nation. Infant mortality was at 12 deaths for 1,000 babies being born versus 7 in the country. And the same poor outcomes were there for heart disease, renal disease, and cancer, particularly in our African American community. I worked in the clinics at that time and saw how horrendous the healthcare of our community was, and we've made some strides. And we seem to be now going backwards. The second thing is that was happening was that the safety net hospital, DC General, as you spoke, was financially insolvent without the revenue to keep up quality of care. And there's a lot to be said about what DC General did not do, but DC General was our safety net hospital for many years. And it was really, again, another horrendous time when that hospital closed. And the third was the city was also financially insolvent, and it was being managed by a federally controlled board led by Anthony Williams. This what I call a trifactor led to the creation of DC Health Care Allowance in 2001, if I recall. Mm-hmm. Some of us fought very hard to have this insurance that follow the patient. In other words, to give the patients the greater freedom to choose their provider of choice. And as Lisa said, I mean, it gets complex as to who belongs in this healthcare alliance, but basically it is a large segment of our immigrant population. Some providers and hospitals at that time refused to participate, and some came reluctantly. As you remember, Joni, it has never been perfect, and yet, as Lisa said, it has been a lifeline for thousands of people. It went through several management renditions. First, it was the Public Benefits Corporation. Some of you know that was sort of the DC General sort of outshoot of the closing. Then it went to Greater Southeast Community Hospital, if you all remember. I worked there for a while. And then it was followed by the DC Healthcare Finance, when the DC Healthcare Finance came separated from the Department of Health. And ultimately, as you know, DC Health Care Alliance has been managed by Medicaid, managed care organizations up to this date. Alliance, as you know, mimics the services of Medicaid in general: primary care, emergency care, in and out of hospital care, specialty care, language translations, disease management, diagnostic testing, and dental services. And while mental health and substance use are not provided under that rubric of care, it is being provided by DC Behavioral Health. And something that we are not talking about, which is, there's a sense that the Department of Behavioral Health will also sunset those services for that population. There has not been enough conversation to let us know whether that's going to continue or not. And then, what does it mean to dismantle these services? I mean, I can actually tell you, because I was working at the DC Health Clinics prior to DC Health Care Alliance being established. And to that, I encounter unwanted pregnancies from lack of family planning, no prenatal care, and showing to the hospital for deliveries, and worse, as I saw it happen because I did home visits at that time in the 90s, people delivering their own babies at home. The use of antibiotics from overseas for every ailment. And we know what the overuse of antibiotics can do to the well-being of communities, not just ours, but the entire, not just the immigrant population, but to the entire community. As this gets transmitted through water and all that, and I won't go into it, but it's dangerous for everyone. Waiting until severe symptoms for preventable issues such as, not getting a mammogram, not getting a colonoscopy. People will die for no access to dialysis, for instance. And something as maybe people don't think of it, but for dental care for pregnant women can lead to having a child that's too early or too small, and endangering the mom's health with dangerous high blood pressure, preeclampsia, as we call it. And then the elderly, as I saw back in the 90s, just curling up and dying because they have no access to any kind of care. And ultimately, I would just say community health clinics will also have a very difficult time without that finance dollars, and almost impossible to serve our immigrant community timely and appropriately. And I'm not being a drama queen. I saw this happen prior to the alliance being established. And so I urge you to please call the council members today and to, call the mayor, call, the people in power to make sure that this insurance at least stays through FY26 so that we can have the time to plan for a better system for this population. Thank you so much. It has been such a privilege to work with you, Joni, and to be part of this city since I came to this country when I was a teenager from Colombia.
Oh, wow. We're so excited to be reunited. And again, listeners, for those of you who don't know, we've been working on these issues. So To Heal DC started in 1992, and we were working before then. So we're back to where we started or worse. But we're so thankful to have Maria with us. Maria, just real quick, your last comment. What would be the impact on Mary Center if this goes through?
Yeah, on centers like Unity and Mary Center and Clinica and all the centers that live by sort of the shred of the pennies that they collect. I mean, that means that first of all, they won't have the income to see these patients, but they are obligated. And not only obligated, but they have the heart, as Dr. Sugarman will be speaking very soon, to see these individuals. And the problem is that when you don't have that kind of money, you're not only not taking care of those sort of determinants of health that really help people get better, like housing and food and all those things, but you not even have the money to take care of the piece that is medical. And I know Dr. Sugarman is on the line, but
yes,
she only has a few seconds. So Dr. Sugarman, please take it.
Yes, we're very happy that Dr. Kate Sugarman could join us. She works at Unity Healthcare, Upper Cardozo there, and she only has a few minutes because she's seeing patients. So Dr. Kate Sugarman, tell us what would be the impact to your patients if this goes through?
I can tell you that I have patients that are on dialysis. What is going to happen when the dialysis machine gets ripped out from them because the mayor and the city council have decided that they're not interested in funding DC Health Care Allowance for my patients? So what happens to a patient who needs the dialysis machine, who has kidney failure, needs that machine in order to live? What about my diabetic patients? The diabetes injections are only affordable if you have health insurance. So my diabetic patients are going to lose the life-saving medicines that they need in order to live. I have diabetic patients that have eye damage from the diabetes. They go to an eye specialist and get laser treatments and injections to preserve their vision. So the mayor and the council chair, Mendelson, and health chair, Henderson, are telling my patients, it's okay. I don't care if you go blind. I don't care if you have cancer. I don't care if you have heart disease. So we can call them and urge them to continue the funding for DC Healthcare Alliance for fiscal year 2026. Chairman Mendelson's office is 202-724-8032. 202-724-8032 is Chairman Mendelson. Councilmember Henderson is the chair of the Health Committee. Councilmember Henderson said she cares about maternal mortality, yet these cuts will rip out prenatal care coverage for the pregnant patients in the district. If Councilmember Henderson cares about pregnant patients having access to prenatal care, then you need to call her office and tell her to keep the funding for DC Healthcare Alliance for fiscal year 26. 202-724-8105, 202-724-8105, so that pregnant patients can continue having prenatal care. Otherwise, we'll pay for it in the other end when there will be a spike in premature births, and we'll have special needs and very sick children as a result of Chairman Mendelson and Health Chair Christina Henderson's because of their cuts.
Absolutely, not to mention the crowding of the emergency rooms, which is going to impact all of us. So again, as we say, an injury to one is an injury to all. Before you go, Kate, any last words about the people who maybe just have basic needs? They may not have severe diabetes yet or heart disease. How will it impact your adult patients who are just trying to get a little healthier?
Right. I mean, patients have read the memo. They've gotten the memo. They come in for physicals. They come in for cancer screenings. They're doing everything that we tell them. So now we're saying, well, don't worry about your cancer screenings. Just wait till you have cancer and then you can go die. I mean, it's just, people come in for checkups and people come in for, to get their blood pressure checked. All these things that we've been preaching all these years, come in while you're healthy. And now we're saying, well, we don't care, but we do care. I'm a doctor at Unity Health Care. We do care. Mary Center, we do care. And we've got to put enough pressure. Politicians often don't do things to be nice. Politicians do things because the community cries out and puts pressure on them. So we've got to pressure Chairman Mendelson. We've got to pressure Council Member Henderson. We've got to pressure them that we care. And because we care, they need to care. Our lives matter.
Thank you so much, Dr. Kate Sugarman. We're very proud of you and the work you're doing. And I want to let listeners know that Kate Sugarman is also a proud union member. She's not just a doctor. Being a doctor is great, but she's a member of the, Kate, say the name of the union.
Our union is UAPD, Union of American Physicians and Dentists, but a lot of DC unions are on board with this. SCIU, Local 25 with the restaurant workers has been boosting this because a healthy workforce is good for all of us. And DC Healthcare Alliance provides affordable healthcare. Private market health insurance it's unaffordable and it doesn't even cover what my patients need.
Thank you, Kate Sugarman, and good luck. We hope we move forward with the needs of the community. Thank you.
All right, thank you. Back to my patients.
Yes,
okay.
Back to your
Thank
patients.
You. Okay.
And we have two more guests we're going to hear from. Michele Tingling-Clemmons, hopefully is not someone who you don't already know. She calls in on shows many over the years, and she was one of the founders with me of this show in 1992 when we were fighting around saving DC General. She's also a Ward 7 resident and on the WPFW local station board and a supporter of the radio station. So, Michele, if you can explain to us, and this hopefully it won't be too complicated, how the issue of the stadium, which again is going to be, I think, voted on today as well, the mayor's budget, the proposed stadium by the mayor, how this fits into this issue of cuts in the DC Health Care Alliance or elimination of it.
Well, thank you, Joni, for asking for this kind of input. And actually, the stadium, they separated out the stadium vote. That doesn't start till tomorrow. But today is the day to call to save the alliance. And the reason why it ties into the stadium, I know people have been seeing that the mayor has proposed giving over $1 billion to the billionaire owners of the Commanders to bring the Commanders back into DC and redo the stadium, RFK Stadium, that we currently have that's falling apart. But whenever we talk about the needs, and I don't know how many people know, and I don't know that it's been mentioned on the show, but for $48 million, the district can continue to fully fund the Alliance for 2026 and give us an opportunity to help identify alternative sources of funding to keep the services going, because as Kate says, it means life and death to many of her patients. But the way in which it fits in is that where is that $1 billion going to come from? Well, it's supposed to come from us, folks. If they have $1 billion to give to stadium owners, billionaire stadium owners, then they can pay $48 million to save the lives of 28,000 of our fellow and sister residents. The stadium deal, and some people have different issues about whether or not they want the stadium in, but my problem with it is that it takes and it does not give. The Commanders get the right to develop the land outside of the stadium. They only have to pay a rent of $1 a year, which is worth $6 billion a year to the district. They get to keep all the revenue from tickets, merchandise, ads, food, and parking. Sales taxes go to the stadium upgrades, not for our residents' needs. Then they want to promise them 8,000 parking spaces. Well, I don't live on that side of the river, that part of Ward 7, but I know what it's like trying to park anywhere near there because it's right next to the metro. You know, it's a major metro station. They're not talking about upgrading that or putting any money into metro, but they want to take money and give it to them to take 8,000 parking spaces around RFK, which is only going to demonize and make it very difficult for the people who live there. And what oftentimes people come back and they find that their designated parking has been taken up by these interlopers coming in from out of town who don't know how to use public transportation and don't necessarily respect us in our parking spaces anyway. The problem is that all of those things would overwhelm our residents, and none of that is being accommodated for in the current stadium deal. So how that works is that, again, the mayor is proposing, and apparently the council is going along with it, to give away more and more of our stuff without giving us anything back. No, nothing comparable. They don't say how many jobs. They don't say what kind of jobs. They don't say that those jobs are guaranteed to go to district residents, because we know what happens when those jobs are promised. They rarely go to us. They promise it and then they put in conditions that make it not possible for our residents to be able to take advantage of it. So I want to know, where are the benefits coming from this stadium deal? There's a whole lot of smoke and mirrors, but there's not enough substance that is going to our residents, to my neighbors on the other side of the river around the stadium, or to the residents of the district. And in the meantime, what we're not getting is being taken away from us. We cannot afford to lose more in the healthcare field because we're already under attack by the federal government, the Congress, the federal, the
President.
Yeah, that's the president. I know. Executive. And the Supreme Court. So we have to take care of ourselves.
And again, Michele, how much money is the mayor proposing in the budget for this stadium?
Well, the mayor's offered $2.2 billion for a stadium at RFK.
Yes, and so we're talking about 48 million to save a program that serves 28,000 people.
That's right.
And I believe that there may be some rallies taking place today or tomorrow about this. Do you have any of that information?
My understanding is that there's a rally underway right now down at the Wilson building. I think there are a number of organizations that have coordinating that, and that includes DC for Democracy, that includes Fair Budget Action. So you can meet some of your fellow activists and neighbors down there who also have concerns, knowing that we keep us safe, and taking resources away from our healthcare, away from our vulnerable residents, and putting it to a bunch of billionaires to promise them to be able to take more and more is not what we need. And we need people to contact the council and let them know now, do not end the alliance. We don't want to sign on to killing a number of our residents, because people will die if they make those cuts. And we're the ones who have to stand up for it. They're fellow and our sister residents, and we don't want them harmed. And we don't want them harmed as much as the federal government is trying to harm us. So we have to fight back. This is our fight.
Yes,
and we still have time. Call them by noon. You still have time to get to them before they go in to vote.
Yes, and we're going to hear from you hopefully at the end of the show, Michele. And I believe that several organizations also have a rally Tuesday morning in front of the Wilson building, specifically focused on the stadium issue. That's DC for Democracy and other groups. So you're listening to WPFW 89.3 FM. This is Joni with Trujillo DC. We're talking about the new and ongoing crisis facing our healthcare system in DC. Issues that we discussed decades ago are roaring back and even worse than they were in the early 90s. So we're talking to some of our healthcare champions, and I'm pleased and honored and excited to introduce our final guest, and that is Dr. Edwin Chapman, who many of you may have heard him on my show, on Roach Brown's show, Tuesday mornings, on Ambrose's show. He is really a hero in the community, very beloved hero, dealing in recent years with the issue of the opioid crisis, helping many residents, and is definitely a part of our community right here, and definitely a part of this program. Welcome, Dr. Chapman. And I'm going to just say that Dr. Chapman actually has some good news at the end of his his initial comments. So welcome, Dr. Chapman.
Hi, Joni, and all listeners. Thank you for having me on.
Well, we're thrilled to have you. So what can you add to what's already been said about this issue with the proposed dismantling of the DC Alliance? Perhaps you could talk a little bit about the mayor's role in this, perhaps someone named Wayne Turnage. So welcome, however you'd like to start it.
So, Joni, I think what we really have to analyze is this overall satellite view of our healthcare system. And I'm going to call this voodoo healthcare economics, because it's really the assumption that by not giving people healthcare that they disappear. And they don't disappear. They just cost more money. If you take away a person dialysis, just imagine what's going to happen. That person is going to end up in the emergency room. And by law, our hospitals have to accept those patients and treat those patients. So you're really going to end up having hospitals treat patients for free, which is going to undermine their economic basis. And this is actually going to cost more money. So all of these takeaways from so-called invisible people really are going to end up costing us much, much more money. Preventive health care, early interventions is really the way to go. We're the only country, we're the only industrialized country that does not have universal health coverage. So we really have to rethink and stand up for our healthcare system. I'll tell you, the largest health insurance company, United Healthcare, if you notice over the past several months since the assassination of their CEO, their stock has dropped almost in half, and they're now scrambling. They're really the prototype for this so-called for-profit healthcare system that's falling apart. And many of our Medicare Advantage companies and Medicaid MCOs follow that model. So we're really seeing the demise of our for-profit healthcare system. This is a sham system, and we as physicians, you've heard from Dr. Sugarman, you've heard from Dr. Gomez. We're not here to tell you falsehoods. We're really telling you that we're seeing the unraveling of a medical system that does not work for individuals. It works for profiteers and people on Wall Street who want to make a lot of money. And that's what we're fighting against.
Absolutely. And as we often say, an injury to one is an injury to all. And some people may say, oh, those are immigrants that have nothing to do with me. Some people may think. But this will impact everyone, actually, not just people in D.C., but it'll impact the whole region. And maybe you can describe that a little more, Dr. Chapman, in terms of just the emergency rooms are going to be much more crowded.
Well, if you look at Cedar Hill that just opened, 80% of the patients who are being seen in the emergency room are patients who really should be seen on an outpatient basis in preventive primary care. So what that means is that you're overwhelming the hospital from the very outset with issues that could have been taken care of at a much lower cost. That's the system that we're going to see not only here but all over the country if we don't intervene as a community. We are really in a crisis situation with the changes proposed in the federal budget, the so-called Big Beautiful Bill that just got passed is really designed to remove somewhere above 10 million people from health care coverage. I consider that to be anybody that would take health care from someone else, I consider to be a mass murderer. And I think that's how we have to look at it. This is organized, systematic mass murder. It's just done through public policy without a gas chamber or guns or hanging. It's just another way of killing people.
Yeah, and people don't understand this. I'm going to ask you one more question, then I want you to come to some good news that we have. Some people may remember the name of Anthony Williams, who was our mayor a few decades ago, I believe. Tell our listeners just briefly what his role may still be.
Well, Anthony Williams is the CEO of the Federal City Council. And the Federal City Council represents the business interests of our city. And one might suspect that the design of many of the things that we're hearing, for instance, putting a football stadium or $500 million to improve the basketball and hockey arena before healthcare and before taking the homeless off the street. These are just inhumane as far as I'm concerned. It's a corrupt value system. And I think we all know that taking care of people in a proactive way, taking care of our neighbors actually saves money and actually improves our lifestyle and our safety in the community.
So what would you recommend listeners do today?
I think our listeners should pressure the city council, pressure the mayor to first put people first, put healthcare first, put housing first, and then talk about these athletic stadiums and so forth. I think it's really miseducation of our children to, for instance, describe the District of Columbia as the sports capital of the world. We're not the sports capital of the world. We are the leaders of the world in terms of life and death circumstances. Every day in the White House and the U.S. Capitol, decisions are made about life and death. And this is exactly what's going on. That's what this city is all about.
Yes. And let me say, because we're running out of time, but I believe hopefully in the future we are going to expand on this discussion because it's critical. And again, it's really how this show started. But we have there's some good news that Dr. Chapman and I are going to talk about. First of all, I want to mention people may know that Wednesday is the 60th anniversary of the passage of Medicare and Medicaid. 60 years ago, July 30th, what was that, 1965, these bills were passed. Well, folks, these bills didn't just miraculously pass one day. It was organizing for years. And two organizations I want to give a shout out to is the Black Physicians. The National Medical Association played a key role in the passage of Medicare and Medicaid. Somebody right here from Washington, D.C., Paul Corneli, who Dr. Chapman and I know, who was on this show many times, he played a key role, together with an organization called Medical Committee for Human Rights. And if you go back into the history, you can see photographs of the doctors carrying signs. We need universal health care. We need Medicare. We need Medicaid. So that is an important day this coming Wednesday, which we should keep in mind. But I also want, and we only have a couple minutes, Dr. Chapman to share. He just returned from the National Convention of the National Medical Association. And I think he has some good news to share with us. And again, we'll come back to this in the future. But Dr. Chapman, tell us some good thing, a particularly good thing that happened at the NMA convention last week.
Well, I would also like to point out that Dr. W. Montague Cobb was the only physician present when President Johnson signed the Medicare bill. He was the only physician, and he was a past president of the National Medical Association. So, yes, I just came back from the national meeting of the National Medical Association in Chicago, and we have two major leaders right here in Washington. Dr. Georges Benjamin, who's the executive director of the American Public Health Association, was in Chicago, and he's made many statements about our healthcare system, the fact that we're the only nation that does not have universal health care. We don't spend as much money on primary care prevention, as already been mentioned today. And other countries spend their money providing upfront support for their citizens. we spend our money on sick care. So at that convention, the new president of the National Medical Association is Dr. Roger Mitchell, who was also the president of Howard University Hospital. And Dr. Mitchell has a 4-pillar plan for improving health care for all. And that includes healthcare intelligence, education, and economics. Number 2 is environmental health and justice. Number 3 is healthcare justice, access, and continuity. And the 4th is building our healthcare workforce. And I want everybody to really understand that you don't have to be a physician or a nurse or even a primary medical provider. As a community member, you are a healthcare provider if you help your neighbor. And
Absolutely.
That's going to be the key moving forward, is looking out for one another.
Absolutely. And so we will be discussing this, and I'm sure other of our PFW hosts will as well, because the new president of the National Medical Association is right here in Washington, D.C. I always hear outstanding reports about him. So this gives us hope that perhaps as we move forward into the future, we can reinvigorate some campaigns with help from organizations such as the NMA. And Dr. Georges Benjamin also used to be the director of the DC Healthcare, whatever we called it back then. We had another name for it. But so he knows DC, and he's worked with us and certainly been on this show over the years. So we have a few minutes left. I'm going to give some quick announcements, and then I'm going to ask Michele and maybe Maria to jump in with the final statement. And we're going to go out with a special 2-minute editorial that Michele produced. I just want to say, stay tuned. At the end of this show, you can hear the new program with Mark Thompson, Make It Plain, at 11 a.m. I also want to announce that next week we go into our pledge drive. 2 special things happening this week. Tomorrow, at Tuesday at 5 p.m., I'm going to be doing a special show with Salim Hilton, who was used to have a show on WPFW. He is retiring from the African American Music Association. He's been 50 years in community service, particularly in restorative justice. So that's tomorrow. You can hear us at 5 p.m. He was supposed to be on today, but I had to switch everything around for this crisis. Also, this Friday, there's a special community sing at 6 p.m. with the DC Labor Chorus at Community Baptist Church, Capitol Heights, Maryland. I want to thank our wonderful substitute engineer who jumped in today. But let's go back for to wrap up the show. Let's see, Maria, I'm going to ask you and Michele to give your final statement. If you want to say marching orders or recommendations to the listeners.
Sure, I'll go ahead. This is Maria, and I just wanted to make sure that people have the numbers for the council members. Please call 202-724-8105 for Henderson and 202-724-8032 for Council Chair Mendelson. And just as a reminder, today we're talking about the Alliance, but at the same time, let's keep an eye and let's keep grounded to information regarding Medicaid. Medicaid is also being dismantled in so many ways for the adult populations. We need to keep an eye on that because it's going to the Affordable Care Act for many of our poorest population. The poorest is staying in Medicaid with DC Health Care Finance, but the 138% to 200% of poverty is going to Affordable Care Act, and the group there in some of the benefits are being dismantled for that population. And also, I want to give a shout out for us to advocate for TANF. I mean, there's also another piece food and benefits for our poorest are being dismantled in many ways. So this is affecting all of us. I know it's so much of it is coming from the feds, but there's so much that our city can do with the money that we have. Thank you.
Yeah, yes. And again, Maria, as you were saying, that these votes are happening today, tomorrow, perhaps Wednesday. A lot of these decisions are going to be made. And I may ask you to give those numbers out again. But Michele, your final words.
Yeah, and thank you so much, Joni, for doing this show today. I know it seems last minute, but we still have time, folks. I want to join Maria and Kate and Lisa and remind you that we are the ones we've been waiting for. We can make a difference. And I know Maria said a lot of these attacks are coming to us directly from the feds, but the district is where we have at least a modicum of control. And these are the people that we elect to represent us, and they keep trying to overdo things like overturn our referendums and slow down on the ability of the working class to survive and thrive in this city. But we want to put our foot in the ground. No to the cuts in health care. No to the cuts in the alliance. Stop going after our housing cuts, our housing benefits. Stop going after our education. Stop going after our educators and the workers and the other people who are doing the things that make this city a wonderful place to live. This is our city, and it's time that we make them remember that we're the ones that they need to be concerned about, much more so than the guy who lives in the house that enslaved people built. So thank you for giving us this opportunity. And Maria can give the numbers again, but remember, folks, call. I can give you the number for my council member, for Council Member Felder, 724-8068. That's area code 202. And that's just another council member. All of them need to be called.
You say that number again?
202-724-8068. That's Council Member Wendell Felder, Ward 7.
Okay, and I also want to thank Lisa from DC Legal Aid for joining us today, as well, of course, Dr. Chapman, Dr. Sugarman. Maria, give us again your final, the final
numbers?
Yes.
Yes. Councilmember Henderson, 202-724-8105. And Council Chair Mendelson, very important. He has all the power. 202-724-8032.
And Maria, what about people say, well, what's the point in making a call today? Or, it's too late. They've already had their minds made up.
No, they don't have their minds made up. I mean, I have to say, for some of these council members like Felder and others, this is a very hard issue. They've been wrestling with this. But I think that hearing from their constituents is very, very important. It's the most important thing. I mean, they're elected officials. So this is not too late. Please don't, so many countries, right? So many people that come here is because they have countries where we don't have the freedom that we have here to call our council members and hold them accountable. So let's use that power.
Okay. And one more time with the numbers.
Okay, 202-724-8105 for Councilmember Henderson, and Council Chair Mendelson, 202-724-8032.
Okay, thank you very much, Maria Gomez, Michele Tingling-Clemmons, Dr. Edwin Chapman, Dr. Sugarman, and Lisa Meehan. Thank you, and we're going to go out with an editorial with Michele Tingling-Clemmons. Remember, we take care of us.
The mayor's budget proposal before the city council would dismantle the DC Health Care Allowance that provides critical health care coverage to low-income residents, mostly immigrants, who don't qualify for Medicare or Medicaid. The alliance was created in 2001 in the wake of the closing of our only public hospital, DC General, to cover very low-income residents and immigrants, part of our historic commitment as a sanctuary city. Mayor Bowser's budget includes many things that will harm our low-income and working-class residents. Drastic public health care cuts are a top priority and will likely strain emergency health services for the city. Cuts proposed to the Alliance will compromise or end health care for 28,000 of our most vulnerable residents, few if any of whom will be able to afford private health insurance. Given the all-out assault on the people by the executive branch, the Congress, and the Supreme Court, the need for the Alliance will clearly increase. The fact is, we keep us safe. With $48 million in next year's budget, the Council could fund the Alliance and continue protecting 28,000 D.C. lives. The D.C. Council must put residents first and not double down on the harms that federal lawmakers have already caused our immigrant neighbors, our communities, our country, our democracy. Let us be clear. Cutting the Alliance now sentences thousands of our neighbors to death. This is unacceptable. As D.C. residents, we expect our City Council members to address these budgetary concerns. The final vote takes place on Monday, July 28th. We keep us safe. This has been Michele Tingling-Clemmons for To Heal D.C., a Ward 7 resident, LSB member, and longtime WPFW listener with a WPFW editorial.